Thank you, Chair. Thank you, Secretary of State. My questions are around risk and the COVID alert level. Five definition states material risk of healthcare services being overwhelmed. What's your assessment of the absolute risk to the NHS at the moment in a percent? Are we 10%, 50% likely to hit this in the next 2 weeks?
It's impossible to put a number on it. And I don't mean that just as a cop-out. I mean that in reality, because what happens is that as the NHS, this as better, better than anybody being an NHS doctor, but as the pressure on the NHS grows, so it is more stretched in delivering the services that people need. And we've seen in this second peak that the areas have had to cancel routine electives. First, what are so-called P4 electives, that is those where a delay may be uncomfortable but isn't a problem, and then P3 where they really ought to be done in the next 3 months, but it's okay if they delay a little. And so that is the pressure.
So you probably saw the leaked document about what's going on in London. Do you have every faith that we're able to cope in London with the NHS?
Well, yes, I'm sure that the NHS is going to do everything that it possibly can to ensure that everybody gets the care that they need. And of course, firstly, in London, we have built significant more critical care capacity over the summer. We spent the summer extending critical care capacity. And then obviously, we also have the Nightingale on standby. There were some rumours that it had been decommissioned. They were wrong. The Nightingale is on standby. But of course, the Nightingale is the physical capacity. We also need the people, and hence bringing people back into the NHS, and also, ultimately, people when hospitals are busy and full, then clinicians become more stretched, and I that's why we should be also grateful for the service that they're giving.
And moving on from, Laura Trott made some points earlier talking about the ambitious plan to get 13 million vaccinated, which is fantastic. And you've talked about the 85% change in the risk there. Do you have a concern, though, about what that means for the population who aren't vaccinated, who don't see the virus as such a risk, and how they will behave?
We've always got to monitor these sorts of behaviours. What I would say, though, is that especially in this national lockdown situation, people are by and large very, very respectful of the rules. There are some people who break the rules, of course there are, but generally, compliance has been good, and that's very, very important because it's the only way that we can control this until we have the vaccine rolled out. Now, when the vaccine is rolled out more broadly and vulnerable groups protected, I hope that people continue to be, respectful and also take personal responsibility for trying to reduce the spread of the virus, because that way we can lift more restrictions.
Now, Prof. Whitty talked a lot about the fact that society is going to need to have a discussion around the risk, a bit like we do in traffic. What's the right speed limit? How do we approach dualling carriageways, things like that? What conversations are happening in government around facilitating this? When do you see it coming into play? Because many people, like the hospitality, the businesses, will be thinking, when the vaccine comes, we need to get back to normal. When is that right point going to come? I appreciate you can't answer that directly, but the discussions are really important in how we feed in.
Yeah, I think that we need a national discussion about it, frankly. Of course, government has a view, and both the clinical advisors to government and also as politicians, because ultimately these are political judgments in the best sense, as in weighing very big concerns and balancing big judgments based on the best clinical advice. And Parliament has an important role, and indeed this select committee, I think, will have a very important role in balancing those considerations of how we deal with this over the medium term. We've seen with the new variants that, like flu, it is likely that we're going to have to, that when a new variant comes, thankfully, there's no evidence yet of one that will escape the vaccine. But should that happen, then we'll need to iterate the vaccine in the same way we do for flu. It's totally normal for flu. We've done this for decades. And that's where this will end up. But the path of getting from here to there taking into account all the other impacts, the economic impacts and the other health impacts of the actions that we have to take, that is ultimately a national debate.
Thank you, Chair.
Thank you. Sarah Owen.